Now tonight, a major change in Cleveland's medical landscape. St. Vincent Charity Hospital is transforming itself and soon will no longer provide inpatient care.
We have team coverage on this story this evening. Christy Paul has a reaction to the decision, but we begin with our senior health correspondent, Monica Robbins, to explain what happened.
The Sisters of Charity of St. Augustine provided care to Clevelanders for 171 years. But the changing landscape of healthcare in the fallout of the pandemic is forcing them to redesign delivery.
This is a sad day for us, without a doubt. We have been spending decades, really, to really understand how we can continue to care for the people in this community.
They will transform into a holistic health campus. While patients will no longer stay overnight, they can still visit their doctors and receive mental health and addiction treatment on an outpatient basis. The emergency department will change.
We have been able to take care of the patients and their more urgent care needs, and we will continue to do that, and we think that's the right space for us.
St. Vincent is one of several hospitals fallen prey to the pandemic. Healthcare delivery is moving away from inpatient care to home care. The hospital's been struggling for years, depending mainly on Medicare and Medicaid reimbursement. The shutdown pushed it into the red.
But that stopping surgery had a significant impact, and I can tell you, in that first month, St. Vincent's lost $3 million. And if you would extrapolate that going forward, that's not sustainable.
Care will continue until November 15th. Remaining patients will be transferred to other hospitals. 100 employees will remain. About 600 will be let go, but they may not have to look far. University hospitals will be recruiting beginning Monday. In a statement, Cleveland Clinic said, in part, "We welcome those in clinical roles to consider joining Cleveland Clinic. Current openings are now available." Metro is already planning a job fair at Tri-C next door. As for the future, the hospital says the community had a say in what they needed, such as prescription needs, food and nutrition, workforce development, and transportation and housing.
And we're iteratively going back to the community saying, did we hear correctly? Is this really what you want that can really help you to lead healthy lives? And so we are continuing to keep that dialogue going.
And I just received word that Metro Health already planned a job fair for the impacted St. Vincent employees for tomorrow, Friday, and Monday at Tri-C next door. The info can be found on WKYC.com. Now, one critical piece of St. Vincent that will remain is Rosary Hall. Founded in the 50s and provides renowned addiction services. It will continue, but on an outpatient basis. It had been used as a detox center for many, but now inpatient treatment will have to be done elsewhere. The new health campus focus will be more on the social determinants of health that Central residents said they wanted, but not all are pleased with this decision.
Again, this hospital has been around since 1865. Put it in perspective for us. How big of a deal is this? You know what? It's the changing face of healthcare. It's not the first hospital. It is not going to be the last, unfortunately. However, you know, I think we saw this coming for the last couple of years. I'm surprised it stayed open as long as it did, honestly. Okay, Monica Robbins, thanks.
Sure. And now we want to go to reaction from the Salvation Army's Harbor Light Complex. It's just blocks from the hospital and relies on it so heavily for its residents. Christy Paul is here now. You actually spoke with them today. What did they tell you about what's next? Because it's so important for them.
It is. It's very important for them. And the problem is they don't know what's next. They're trying to figure out what a day-to-day basis is going to be like to help the people that come into the Salvation Army that they serve. So the question is, because I talked to Bo Hill, who said, look, the struggle here is real. The question is, will that intensify? Today, Cleveland City Council said they're disappointed by the decision. The executive director of the Salvation Army there says the proximity, that's what's key here, being able to get to the hospital, do it fast. Salvation is just 4 blocks from St. Vincent, and that's pivotal because, as Hill points out, there are so many people that they serve that don't utilize healthcare the way the general public would.
Oftentimes we go to our general practitioner for regular checkups and things of that nature. And for those that we are called to serve, that's not the typical way that they access healthcare. It is when there's a significant need that arises, that's when they reach out for help.
So Bo said, in terms of trying to figure out what is next, they're just going to have to go with the flow at the moment, see what is in their future, what is going to be available to them and to the people that come in to be served and to get help from the Salvation Army. The one thing that Bo was very adamant about was that he knows how hard this is on everyone, doctors, nurses, the healthcare industry, and that what he's doing right now is he's praying.
Oh,
and he's praying for everybody.
Not ideal for them, but the power of prayer, hopefully it comes through.
Amen.
All right, Christy, thanks.